Okay, let's break down an OSCE station that can feel pretty intimidating. Telling a family you've missed a fracture. This is all about your professional duty of candor, and we're going to walk through exactly how to handle it with confidence.
Welcome to this clinical walkthrough on a missed fracture case for UKMLA, brought to you by Mediate, your 24/7 practice partner.
We're going to tackle this consultation in 6 clear stages. If you follow this structure, you'll have a solid framework to guide you through the entire station, step by step.
Right, let's start with stage 1. Those first few moments are absolutely crucial. This is where you establish an empathetic tone and set the agenda for the meeting. It lays the groundwork for everything else.
You'll want to kick things off with a warm, professional introduction like this one. See how it immediately shows respect? You're thanking them for the inconvenience of coming back. It's a small touch, but it starts building that trust from the get-go.
Now, this is how you set the agenda. You're flagging that this is a serious conversation, but you're not dropping the bombshell just yet. This is so important because it prepares the parent for difficult news instead of completely blindsiding them.
On to stage 2. Now listen, before you say anything about the mistake, your clinical duty is number 1. You have to assess the patient's current condition. This shows them that their child's health is your absolute top priority.
So you're going to ask these questions systematically. You're checking for any red flags. Is the pain worse? Is there swelling? Can he still use the limb? This shows the examiner and the parent that you are a careful and thorough doctor.
Next, you need to gently confirm what they remember from the last visit. This isn't about blaming anyone. It's about making sure you're both on the same page before you introduce the new, conflicting information.
Stage 3. This is the big one, delivering the difficult news. You need a specific approach here to make sure you do it with empathy and total clarity.
So let's talk about the warning shot. This is a communication tool you absolutely need in your toolkit. It's a short statement that gives the person a moment to brace themselves for what's coming. It softens the blow by signaling a shift in the conversation.
Here's a perfect example. That word, unfortunately, does all the work. It instantly changes the tone and lets them know that what you're about to say isn't good news. You're guiding them into the disclosure.
And then you deliver the news. Be direct, be honest, and apologize right away. Use simple, clear language. A small hairline fracture was missed. No room for confusion. And that apology needs to be upfront and sincere.
Okay, now for stage 4. Your job now is to manage the parent's reaction. You can expect them to be angry, worried, frustrated, and you need to be ready to handle that constructively. This 3-step model is your best friend here. First, acknowledge their feeling. Second, validate it. Tell them it's a completely normal reaction. And third, empathize by sincerely repeating your apology. The most important thing is to not get defensive. Just use this framework.
This is almost guaranteed to be their first question. It's their biggest fear. You need to see this question coming and have a clear, honest answer ready to go.
Your answer needs to be both reassuring and factual. Explain that these small fractures in children heal incredibly well and that long-term problems from this kind of delay are unlikely. You're directly addressing that core fear.
You know, managing both the clinical side and the emotional side of a conversation like this takes practice. To build up that confidence, you can practice this exact case right now and get objective feedback on mymediate.com.
All right, once you've managed that initial emotional response, you need to switch gears and lay out the plan. What's going to happen now? This shows you're in control and gives the parent a clear path forward. Lay out the immediate clinical actions clearly. This is your management plan. You're going to reassess, immobilize, refer to ortho, and set up a follow-up. This shows competence and reassures them their child is finally on the right track. It's also a good idea to actually name the formal process you're following. By mentioning the duty of candor, you're showing the parent that this is a professional, transparent protocol and that the hospital is taking this seriously.
And part of that duty is offering support. Explain what PALS is. This empowers the parent. It gives them an independent place to go for advice or to raise concerns, which shows that you're being completely open and not hiding anything.
And finally, we're at the end, closing the consultation. How you end this conversation is just as important as how you started it. The goal is to reinforce that you're taking responsibility and to reassure them about the care ahead.
A statement like this is so powerful. It shows you're reflecting on what happened, personally, but also systemically. By saying you've learned from this and that the whole department will be made aware, you show a real commitment to making sure this doesn't happen again.
Your last words should come back to that sincere apology and a focus on the patient. Bring it all back to the child's well-being and a smooth path forward. It ends things on a supportive, professional, and proactive note.
You can practice this exact case now on mymediate.com.